On this edition of Veterans Health Watch, we'll learn about the VA Maryland healthcare system's commitment to patient safety. We'll also learn what the healthcare system is doing to educate veterans and their family members about the risk factors and warning signs associated with suicide. So please join us. Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland Healthcare System that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. The VA Maryland Healthcare System's mission is to honor America's veterans as heroes by providing the highest quality health care. Inherent in that mission is the provision of safety for veterans, their family members, and employees. And joining us to talk about the Patient Safety Program for the VA Maryland Healthcare System is Susan Russo, Director of Patient Safety and Risk Management. Susan, thank you so much for joining us.
Thank you, Kenya. I'm glad to be here.
Can you describe for us your role as the Director of Patient Safety and Risk Management?
As the Director of Patient Safety and Risk Management for the VA Maryland Healthcare System, I oversee the development and implementation of a comprehensive patient safety program at the organization. This patient safety program is designed to reduce and prevent the inadvertent harm that can be caused to patient veterans in the healthcare system. As a matter of fact, it's nationally, harm is inherent in the healthcare system across the country, and as often as much as 180,000 medical errors occur on a yearly basis. The patient safety program is really designed at identifying patient safety issues before they occur and can cause harm.
That's great. So why is patient safety so important?
Well, at the VAMX, as you mentioned, Kenya, we're really committed to the provision of safe, quality, and compassionate health care. But we feel like in order to really complete that mission, we have to keep people safe, because safety and quality go together, and safety and quality is really everyone's responsibility in the organization. At the core of that responsibility is what we call the creation of a culture of safety.
And how would you define a culture of safety?
A culture of safety is really a psychological safety where all VAMX employees, doctors, nurses, social workers, food and nutrition workers, housekeeping, that all employees really feel responsible for keeping patients safe and see that as their mission to actually provide quality and safety all the time.
Susan, do veterans and their family members have a role in creating or cultivating this culture of safety?
Oh, most definitely. As a matter of fact, they probably have the most important role, Kenya, because really the veteran is the center of the healthcare team. I mean, that's what we all do every day. The veteran is the focus of the social worker, the physician. Everything that a healthcare team member does is focused on the veteran. So they have probably the most important and very critical role in creating a culture of safety.
And what would that role be?
Well, what we ask the veterans and their family or significant others to do is to be aware of patient safety issues, to be aware of something that doesn't seem right to them, something that they have a concern about or a question, and to speak up about it, to let people know that there's something that they have on their minds that they feel is a safety issue.
And what should be that first layer or that first step? Who should the veteran or the patient go to with that initial concern?
Well, the people that they should talk to first would be their healthcare team. If they have a question about something they don't understand, they should ask their doctor, their nurse, any member of the healthcare team. After that, there's also a patient safety line that they can call at the VA. and reach someone from my department, the Patient Safety Risk Management Department. And then there's patient advocates. There's patient advocates at all of our main campuses, and veterans can access a patient advocate. We all work very closely together because we all have the aim of providing safe care.
And when would you advise a patient or a family member to take that next step to speak up when they notice a patient safety concern?
Oh, right away. I think as soon as they notice something, they should let somebody know immediately, because then we can all start working on whatever the concern might be.
What resources, you mentioned a few of the resources, if you could just reiterate those resources that are available for veterans and their family members to report a concern.
They can talk with their healthcare providers, anyone on the team. They can call the Patient Safe line at the VAMX, or they can speak to any patient advocate.
And by VAMX, you mean the VA Maryland Healthcare
Right,
System?
the VA Maryland Healthcare System.
Yeah, we have a lot of acronyms.
Right.
And I understand that the VA Maryland Healthcare System you mentioned has started a Speak Up program. Could you give us a little more details about that Speak Up campaign?
Well, it's actually not something that's new. It's something that actually comes from the Joint Commission, which is the accrediting body for all hospitals in the state of Maryland. And they have available what they call Speak Up, a campaign. And we started this a while ago, but we've just sort of revisited it again and really put a lot more energy into it at the VA Maryland Healthcare System. And what that means is we encourage veterans to speak up whenever they have a concern, speak up about if they have a question. I mean, oftentimes veterans will, a provider might explain something to a veteran or a family member, and rather than ask a question until they really understand, they'll just sort of think, well, maybe I'll look it up later. We really want them to ask questions. There's never a question that we're not interested in answering. To speak up about medications, that's probably one of the most important aspects of their health care. Veterans need to ask questions about their medications, why they're on a certain medication, how often they should take it, what side effects they might experience, if a medication is being changed, to ask about that, and to let their providers know, especially if they have an outside providers, because some of our VA, our veterans actually see private doctors and who might prescribe them medications as well. So we want to be sure that our providers know any new medications they're on by their private physicians, or any changes that were made, to talk about any supplemental medications they might take, because a lot of people now take over-the-counter supplements of different kind of vitamins, or any kind of over-the-counter medication that they might take. It's really important that the physicians know everything that the veteran is taking in terms of medications, because that's the best way that they can then do a safe or provide a safe medication. To speak up about any procedures that they might be having. If they're not sure, say if they're coming in for surgery, they want to really understand what the surgery is, what it's intended to do, what might happen when they leave the hospital, if there's any special care they need, to really, if they don't understand, to make sure that they keep asking the questions until they feel like they have a good knowledge of what to expect. To speak up about falls. We try to reduce falls. Falls occur in the hospital and in the outpatient areas all the time. And in the hospital, we ask patients to be sure that their call light is close to their bed, that they ask for assistance when they need it. I mean, oftentimes I hear, well, everybody's so busy, I didn't want to bother anybody. Well, we're never too busy to assist a veteran. To use any safe equipment they might have, a cane, any assistive device that they might use to help them walk or to ambulate. We want to be sure that they have that with them. And to point out any concerns they might have when they're walking around the hospital. If they see a spill on the floor or something across the way that could make a fall occur, that they would actually let somebody know so that we could take care of it.
And oftentimes we think of, when we hear patient, we think of an inpatient. Is there anything specific to outpatients that you haven't already mentioned that you want them to focus on when we talk about speaking up?
No, I think it's just important that they know that we really depend on the veteran, whether they're inpatients or outpatients, to speak up when they have questions or speak up about any patient safety concern they have, because we really rely on them. As I said, they're the center of the team, and we need their cooperation to really provide a safe environment at the VA.
It's about that two-way communication.
Correct.
Sounds like it.
Correct.
And do you have a website or a telephone number or some other way that veterans or their family members can learn more about patient safety?
Well, the VA National Center for Patient Safety at patientsafety.va.gov offers a lot of information that's accessible to veterans and their family members. A lot of tips about how to be safe, a lot of tips about what to ask about your medication, a lot of information about the kinds of safety issues that patients and veterans need to be aware of so that they can help us.
You provided great information so far. We want our veterans to remember we want to hear from them. We want them to speak up. Is there anything in closing that you would like to share with our viewing audience about patient safety?
Kenya, I think the thing that's most important is I would hope that when the veteran and their family or significant other walk into the VA or one of our outpatient clinics, that they really see a committed staff who are there to provide safe, quality care, and that they're really a vital member of the healthcare team. I can't stress enough how much we really rely on them to be active participants. I mean, that's the best way for veterans to stay safe, is to be active participants in their health care, to ask questions, to know what kind of health care they're receiving and what the plan is for them, and to be involved in that health care.
Thank you so much, Susan. I really appreciate you coming here today to talk to us about patient safety and how it's being implemented throughout the VA Maryland healthcare system.
Thank you, Kenya. It was a pleasure.
We're going to take a short break, but when we return, we'll continue this discussion about patient safety with information about suicide prevention. So please stay tuned.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
On my last tour, I was a drill sergeant, training some soldiers, and had an unfortunate accident.
I really didn't think I was qualified because I didn't have a service-connected disability.
I researched because there had to be some answer somewhere. There had to be some place for combat veterans to go.
Did you know that the Department of Veterans Affairs has been recognized for offering the best medical care in the U.S.? Locally, the VA Maryland healthcare system provides a full continuum of quality care to our nation's veterans, including medical, surgical, rehabilitative, neurological, primary, mental health, and long-term care. With a dedicated, highly trained staff, the VA Maryland healthcare system is committed to serving the needs of our nation's veterans at 8 locations throughout the state. The VA Maryland healthcare system is always there to serve and honor America's veterans.
At the VA Maryland healthcare system, we're proud of our investment in technology because it's an investment in our veterans.
I was really surprised. It was a modern clinic with doctors for excellent care.
You know, there's a sense of just that camaraderie. You feel really comfortable, and it has been helpful for me.
The categories of care have been opened up so that more veterans can qualify.
I would highly recommend all veterans to at least come down here and talk with the patient representatives and see what they are entitled to.
If you or someone you know served in the armed forces, tell a vet to call 1-800-463-6295, extension 7324, to inquire about enrolling in the VA Maryland healthcare system. It's free to inquire and easy to enroll, so call now.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.
Welcome back to Veterans Health Watch. We've been discussing patient safety. Now let's turn our attention to a national patient safety goal, which is suicide prevention. And joining us to discuss how the VA Maryland healthcare system is outreaching to veterans in crisis is Nicole Jones, a suicide prevention coordinator at the Perry Point VA Medical Center. Nicole, thank you so much for joining us.
Thank you for having me.
Nicole, what is the VA Maryland healthcare system doing to increase the focus on suicide prevention?
Well, first of all, I'm glad you asked that question. Suicide is a national crisis in the general population. More than 40,000 people die each year as a result of suicide. What's more concerning for our veteran population is that 1 in 5 are indeed a veteran. And so the VA just wants to make sure that our providers know what the risk factors and warning signs are for our veterans and increase our knowledge in screening and assessment and intervention methods.
Nicole, I understand the VA Maryland healthcare system recently participated in additional activities to bring more awareness to suicide prevention. Could you tell us more about those activities?
Yes. Once a year we do actually bring awareness to suicide prevention, a month of activities at the VA, and some of the things that we've done are training and education, increased training and education on suicide prevention, the risk factors, the warning signs, as well as suicide safety planning, trying to educate providers and veterans about what coping skills are beneficial to help reduce the risk of suicide, as well as activities to help veterans really know that they're not alone and that suicidal thoughts can occur, but they can reach out for help.
And what other initiatives has the VA implemented to increase the awareness of suicide prevention?
Well, one of the things that we do is we do outreach. Not all of our veterans receive their care at a VA facility. And so we want those who actually treat veterans on the outside in the communities to actually know what the risk factors and warning signs are. This past couple of months ago, we actually participated in the community resource table at the Orioles game. And we handed out brochures and magnets, and we talked with veterans and friends of veterans and family members of veterans to know what resources are available if they ever needed them.
It's very important to keep the community involved in care for our veterans.
Sure, sure.
And how does the National Suicide Prevention Crisis Line work? I've seen commercials for it. And how does it work to help veterans in crisis?
Well, the 1-800-273-TALK number is a 24/7 resource for our veterans. And what's interesting about the hotline is that family members can call. They can say that they're concerned about a veteran and actually seek help for that veteran through that hotline. But basically what it is a resource that provides, basically instills hope for veterans, provides resources, some brief counseling and supportive counseling. And if, say for instance, a veteran from our area were to call the hotline, they would get counseling and they would be screened for imminent risk. If someone is at imminent risk, what usually happens is the hotline will then contact the jurisdiction locally, the police most likely, and actually provide compassionate intervention for that veteran, where they may actually go to their home and then actually take them to the hospital for an assessment.
And give us a little history on the suicide crisis lifeline. I know it's not new, but it has been changed to give more attention to veterans. Tell us about that.
Well, it started out in 2007 as a national suicide hotline, and what we found is that some veterans were hesitant to call. And so in 2010, they changed it to the Veterans Crisis Line. And we want veterans to know that you can call when you're in a crisis before it gets to the point where you're suicidal. And they've even expanded in 2009, they offered chat services for our younger, more computer-savvy veterans, and even text. And to date, I know that they've had 1 million calls, they've had 100,000 chats, 10,000 texts, but more importantly, they've had 40,000 rescues where that many veterans were at imminent risk for suicide, and we were able to intervene and get them to safety.
That's awesome. Nicole, what about the roles of the suicide prevention coordinator throughout the VA Maryland healthcare system?
Part of the initiatives that the VA implemented in 2007 was the Veterans Crisis Line, but also suicide prevention coordinators at each medical center. And basically what our roles are is we provide monitoring for veterans that have been identified as at risk or potentially at risk for suicide. And we provide enhanced care. We call between their appointments. We follow up with them if they miss an appointment. We actually call to remind them of an appointment. We provide education and training for providers, clinicians, and non-clinicians. Our veterans may feel comfortable talking with the dietitian, so we want the dietitian to know what risk factors and warning signs they should look for when interacting with the veterans. In addition, we also provide consultation to the providers, the clinical providers in mental health who actually work closely with veterans who are identified as at risk for suicide. We want to consult with them when they have a difficult case. We want to make sure that we're doing everything we can to keep that veteran safe.
I want to talk to you about the risk factors, but before I go there, tell us about the connection with the Suicide Prevention Coordinator and the crisis line that you mentioned, and how you learn about those calls and what you do from that point.
When we get a call from our local, from a veteran who lives locally, from the Veterans Crisis Line, they actually send us a consult. And it just basically indicates what some of the things are that the veteran is struggling with. And we provide follow-up. We call them at their homes. They may actually come out and visit with us one-on-one, but we provide counseling to them via the telephone, just brief supportive counseling, and connect them with services. Say, for instance, they have a mental health provider, but they don't have an appointment schedule. We can help them get an appointment. Or maybe they're new to the VA, never received care at a VA system before. We can get them enrolled and actually set up with an appointment in mental health. So it's really, we connect them from that local call to our local VA. From the national call to our local VA.
It's good for our veterans to know that connection exists.
Sure.
Yeah.
And that we would be available to them ongoingly if they still need support.
And so let's get into the risk factors associated with suicide prevention. Tell us more about those risk factors.
Well, some of the risk factors include a history of a suicide attempt or family history of suicide attempt, chronic pain, some social issues such as homelessness or legal issues. For our veterans, it could be post-traumatic stress disorder, history of deployments to hostile environments, physical and sexual abuse. That's one general population as well as in the veteran population. So it could be a number of different risk factors, and those are the things that are on board that make us prone to suicidal thinking. But then there are also the warning signs, and those are the things that when we identify those warning signs, we want to take action. And that could be someone saying something as benign as, I just want to go to sleep and not wake up. It's really the beginning of suicidal thinking. And one of the other warning signs that people sometimes overlook is, and in particular family members, is when a veteran is writing about death or talking a lot about death. And that's really an indication that that person may be at risk and they may need to come in immediately, whether they call our hotline, whether they come in through the emergency room, or whether they dial 911 if there's, imminent risk.
And so once the risk factors or warning signs are identified, how should a veteran seek assistance?
Well, they should definitely, I always encourage the veterans that once you recognize the symptoms, reach out immediately. We don't want them to wait until the crisis has gotten to a point where they're so overwhelmed that they need emergency services. We want them to come in, talk to their primary care doctor about what's going on. We have a new program, it's Primary Care Mental Health Integration Program. And so there are mental health providers embedded in our primary care team. And so a veteran could go to see their primary care doctor and talk about their mood, and maybe that doctor, that medical provider will refer them to the mental health provider that's right there in the primary care division clinic. And that would be helpful so that veterans know we're all on the same team, we're all working together.
Yes. Yeah, it's great to see the VA closing those gaps.
Yes.
Closing the gaps. And Nicole, what is the most concerning risk factor that veterans and their family members should look out for?
Well, there are many of risk factors, and one factor could be enough for someone to decide that they want to end their life, whereas another is not for a particular veteran. But one of the things that we definitely have put a lot of attention on is the presence of the firearm in the home or a vehicle, and that's because our mission has been gun safety. 55% of deaths by handgun are self-inflicted. And so we know that handguns are a primary risk factor for our veterans. Because I tell this story a lot when I'm doing trainings, and people laugh, but it's true. If you were to put a gun in my hand, I would probably faint because I've never had a gun in my hand. But our veterans, they've been trained to handle weapons. They know how to dismantle it, they know how to put it back together, and that familiarity is really increasing that risk because they're not afraid of weapons. And a lot of our veterans actually take on jobs where they continue to handle weapons in their jobs, like police officers or security officers. So we implemented a gun safety awareness program. And our focus is not about gun ownership. We want our veterans to know that it's their right to own a gun, but we just want them to have safe measures of maintaining that. We give out free gun locks, and actually to date we've given out 550 for this year. And we don't ask them, do you have a gun? We want them to not be defensive. We say, how many gun locks can we give you? Because some of our veterans actually collect the weapons. And so we want them to know it's not about whether they own them, we just want them to be safe.
That's an excellent program. Nicole, you mentioned one of the risk factors is previous attempts at suicide as suicide. So what can veterans or their family members do to help reduce the incidence of a next attempt?
Sure. Getting engaged or seeking help for the first time is difficult. Maintaining that connection is important to reducing the risk for future attempts. It's important that they stay connected with the provider, that they have regular appointments, that they're compliant with medication if they're prescribed medication, but also to build a supportive network, have a structured activity daily, whether it be vocational work or school or day treatment or volunteer. It's important to have activities scheduled so that they're not idle time. But also too to have family members that are engaged in their treatment, someone that can see if they're doing well or if they're not doing well, and they can actually connect with the veteran and connect with their provider so that we can build that support around that veteran. I tell the families all the time, if you see something, say something. And I think that really helps them to protect their loved ones.
Nicole, we're going to wrap up our program shortly, but if there's one thing you can say to a veteran or family member watching today, what would that be?
It would be that they're not alone, that when people struggle with serious issues, that suicidal thoughts often can be a result. And we just want them to know they're not alone and that we care about them. Their life matters. It matters to their loved ones, their friends, their family, and the VA, and that they've served us and now it's our turn to serve them.
Well said, Nicole. Thank you so much for being here today.
Thank you for having me.
Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101, or visit us on our website at maryland.va.gov or join us on Facebook or Twitter. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please call us at 1-800-463-6295, extension 7324. Visit us on our website or come into one of our medical facilities. We look forward to serving you. Please join us next time.
Hey, Daniel. The gentleman over there, he paid for your meal.
The power of one small action One conversation or one phone call can make a difference in the life of a veteran going through a difficult time. For free 24/7 confidential support, call the Veterans Crisis Line or the Military Crisis Line.